Which of the following is not a risk factor for the development of venous thrombosis in the surgical patient? So, option age greater than 60 is a risk factor. This is true. Pregnancy is the hypercoagulable state. This is also true. And obesity or the BMI greater than 30 is also true. But diabetes is not directly related to the, or it is not a directly a risk factor for the development of DVT. So, answer here will be D. Which of the following is not a complication of the massive blood transfusion? So we know that in the massive blood transfusion generally we found hypothermia. So here the option C, hyperthermia, is totally a wrong option. It should be hypothermia. So answer will be C. In the stage 3 pressure sore is full thickness skin loss extending to. So in the stage 3 it includes subcutaneous tissue but not through the fascia. So full thickness skin will be involved and also the subcutaneous tissue but not the fascia. Fascia is included in the stage 4 and also the other underlying tissue such as the fascia, muscle and bone all will be included in stage 4, not in the stage 3. So answer here will be A, which will not through the fascia. During subclavian vein puncture in the surgical ward, suddenly a patient develops severe breathlessness. On auscultation, breath sounds was absent and the ipsilateral chest was tympanic on percussion. The probable diagnosis is. So it is talking about the surgical ward. So and after that there is a breathlessness and absence of the sound. So it is a case of the pneumothorax, but it occurs in the surgical ward. So it is a case of the iatrogenic pneumothorax, which is occurring at the time of surgery or after the surgery. Collar disease is the avascular necrosis of. This is a direct question. It is a avascular necrosis of the navicular, and for lunate is a Kenblock disease. Kenblock disease. Kenbock's disease. Which of the following is not a true of pyoderma gangreosum? So it is characterized by the cutaneous ulceration with the purple undermined edges. This is true. It is often secondary to heightened immunological reactivity from another disease process. This is also true. Culture often show the gram-positive staphylococcus. This is not true. Generally, staphylococcus is not present. Streptococci may be present, but staphylococci are generally not present. Lesion generally respond to steroid. This is also true. Which of the following is not a tissue repair surgery for inguinal hernia repair? So in the tissue repair surgery, Bassini repair is there, Scholdice repair is there, and Desarda repair is also there. But Stoppa's repair is a type of prosthetic repair, not the tissue repair. So answer here will be Stoppa repair. And prosthetic repair will include Lichtenstein, Stoppa's, TEP and TAPP. These all are the prosthetic repair, and the Bassini repair, Scholdice repair and Desarda, these are the tissue repair. Which of the following type of mesh is recommended for intraperitoneal use in the abdominal wall hernia? So we know that whenever any mesh is considered, then it should be lightweight and the porous mesh. So here the answer will be lightweight and the porous mesh, so that it is not heavy and it will cover greater area. So it should be porous, and porous mesh generally have the better result than the filled mesh. Which of the following is not correct regarding the Mann-1 syndrome? So in Mann-1 we know that parathyroid, pancreas and pituitary are involved, but not the pineal gland. So it does not involve the pineal gland. Answer will be option 4. Which of the following is not a electronic information site in the surgery? So if we talk about the electronic information sites in surgery, then PubMed is there, Embassy is there, Cochrane Library is there, and one another Sinha Health is there. But National Medical Library is not associated with the surgery, so this is not true. Which of the following statement regarding the preconceptional counseling is not correct? So, um, it is needed only in the selected complicated pregnancy. No. Generally, preconceptional counseling is generally done in all the pregnancies, so this is not true. It help in the early detection of the risk factors. This is true. It help in reducing the maternal morbidity and mortality. This is also true, and it is a part of the preventive medicine. This is also true. So answer here will be A, that it is needed only in the selected complicated pregnancy. This is not true. Consider the following statement regarding the non-stress test. Reactive NST indicates healthy fetus. This is true. NST is an observed association of the fetal breathing with the fetal movement. So there is not any observed association between the fetal breathing and the fetal movement. We include these both in the NST, but there is no association, though this is not a correct option. Testing should be started at 20 weeks. This is also not true, because testing generally is done after the 28 weeks. NST has the low false negative rate, less than 1%, but high false positive rate, greater than 50%. This is true. So option 1 and 3 are true, and option 1 and 3 are true, and the 2 and 4 are incorrect. Which of the following is the protective factor for the endometrial hyperplasia? So if we talk about the protective factor for the endometrial hyperplasia, then diabetes is a risk factor for the endometrial hyperplasia, so it cannot be answered. Tamoxifen also increase the risk of endometrial cancer and hyperplasia. Multiparity is the protective factor for the endometrial hyperplasia, and delayed menopause is also a risk factor. So answer here will be C, multiparity. Woman who is not breastfeeding her newborn child is advised to use contraceptive method by. So generally when the woman is breastfeeding a newborn child, then the oral contraceptives are generally avoided for 6 months. But if the woman is not breastfeeding her newborn, then she can take contraceptive as early as 3 postpartum week. So, and initially progesterone only pills can be given, then after that combined OCPs can also be given. So answer here will be A, 3rd postpartum week. Pearl index for the contraceptive effectiveness is calculated in terms of which of the following? So we know that in the Pearl index is mainly for the pregnancy rates and not the abortion rate. So option 1 is correct, and it is calculated in the terms of 100 women's year, not 1000. So option 1 and C is correct. So answer will be D. Option 1 and 3 are correct. Indication for the removal of IUDs are all except. So IUDs are removed in the case of the perforation of the uterus. This is true. Flaring up of the salpingitis. This is also true. And pregnancy with IUD. This is also true. But IUDs are not removed in the case of the cyclical menstrual bleeding. If there is a cyclical menstrual bleeding, then there are no problem with the IUCD. So it is generally not removed in this case. Contraindications for insertion of IUDs are all except. So if we are talking about the contraindication of the insertion of IUD, then suspected pregnancy is the contraindication. This is true. Trophoblastic disease is the absolute contraindication. Severe dysmenorrhea is also a contraindication. But during the cesarean section, generally we put the IUDs after the informed consent. So IUDs can be put during cesarean surgery and also during vaginal birth. So this is not a contraindication. Which of the following is not a contraindication for the use of mini pill? So answer here will be breastfeeding, because mini pill is preferred contraceptive in case of the breastfeeding, so it is not a contraindication for the breastfeeding. Which of the following is the most commonly used surgical method or technique of female sterilization as recommended by the government of India? So in India mostly Pomeroy method is used, or the modified Pomeroy method is used for the sterilization of the females. Which of the following is required for the registered medical practitioner to qualify for the for performing MTPs as per revised rules of MTP Act? So certified for assisting at least 15 MTP. No, this is not true. It is minimum 25 MTP should be done. So option A is incorrect. Diploma or degree in the OBG, this is true. House surgeon training for 3 months in obstetric and gynecology, this is not true. It should be 6 months. And certified training for 6 months in laparoscopic surgery. No, this is also not true. In laparoscopic surgery it is not 6 months, so this is not true. So here only option B, option number second is true, so answer will be B, 2 only. Which of the following is not a support of uterus preventing its descent? So endopelvic fascia is the support, we know. McInroth ligament is also a support. Inguinal ligament is generally a not support of the uterus, and pubocervical ligament is again a support of the uterus. So here the answer will be inguinal ligament, which is not a support of the uterus in preventing its descent. As per ICMR guidelines, which of the following is true regarding the effects of the COVID-19 on the fetus according to the current evidence? So we know that the COVID-19 generally do not have any effect on the pregnancy. So COVID-19 virus is not a teratogenic, this is a true statement. There is an increased risk of early pregnancy loss, this is not true. COVID-19 infection is an indication of MTP, this is totally wrong. There is an increased risk of fetal growth restriction, no, this is also not true. Generally COVID-19 infection do not have any adverse effect on the pregnancy, and it is also not a teratogenic. So answer here will be B. As per the ICMR guideline, which of the following is true regarding the COVID-19 infection in the pregnancy? So COVID-19 pneumonia in pregnancy are more severe with the poor recovery, this is false, as we have already talked that the COVID-19 do not have any additional adverse effect on the pregnancy. Pregnancy women with the heart disease are at higher risk. Yes, this is true, because the already the risk factor is present, and so here the answer will be pregnant women with the heart disease are at higher risk. Vaginal secretions always test positive for COVID-19, this is false. COVID-19 is secreted in breast milk, this is also false. So here the option B is correct. Which of the following is not a method of management of the deep transverse arrest with the living fetus? So if we are talking about the deep transverse arrest, then the cesarean section can be done, this is true. Delivery by ventouse can be done, this is also true. Delivery by application of the forceps to the unrotated head, this is not true. Forceps are generally or should be applied only when the head is already rotated, so it is a false statement. It should not be applied when the head is unrotated. Successful version of the breech presentation is likely in case all the following except. So successful version can be done in the breech when the breech with extended legs, no, this is not true. So answer here will be A, because they are asking about the except. Complete breech with the sacro-anterior position, yes, in this the successful version can be done. Non-engaged breech, this is also true. And adequate amniotic fluid, this is also true. So here option A is incorrect. Implantation of the fertilized ovum occurs on which day following the fertilization? So this is a direct question, it should be between the 5th to 6th day. During total abdominal hysterectomy, the ureter is likely to be injured or ligate during the following step except. So, if we talk about the option 1, during division and ligation of the round ligament, this is not true because while dividing or ligating the round ligament, there is no increased risk of the injury to the ureter. During division and ligation of the infundibulopelvic ligament, this is true. During division and ligation of the Mackendorf's ligament or uterosacral ligament, this is also true. At the vaginal angles while incising the vagina to remove the cervix, this is also true. But option A is incorrect because there is no risk of increased risk of the ureter damage or injury while ligating the round ligaments. A net effect of the antenatal care has been following except. So they are asking about the advantage of the antenatal care. Reduction in the maternal mortality, yes, this is true. Reduction in perinatal mortality, this is also true. Reduction in incidence of institution delivery, this is false. So antenatal care is nowhere related to the institution delivery reduction. Instead, it will lead to the increase in the institutional delivery. So answer will be C. And reduction in maternal morbidity, this is also true. So answer here will be option C, which is the false statement. Which of the following is not a component of active phase in the partograph? So which is not a component of the active phase? Acceleration phase is the component of active phase. Phase of maximum slope is also there. Phase of deceleration is also there. Phase of expulsion, no, phase of expulsion is related to the second stage labor, not first stage or the active phase of the labor. So here the answer will be phase of expulsion. From medical legal point of view, which of the following is not a sign of the previous childbirth? Perineum is lax and there is the evidence of scarring, yes, this is a sign of previous childbirth. Introitus is gaping and there is the presence of Carunculae myrtiformis, this is also true. Abdomen is lax and loose with the stria and the linea alba, this is also true. Conical cervix, this is not true. Conical cervix is not found if there is a previous childbirth. So answer here will be D.